Hello, and welcome to COVID-19 and the Stakes for Democracy in Latin America. My name is Carmel Shachar. I'm the Executive Director of the Petrie-Flom Center. We are delighted to welcome you to this event. The COVID-19 pandemic is not just a health crisis or even an economic crisis, but it's also a crisis that is a critical inflection point for democracy and the rule of law. I can think of no region more important to discuss the interaction of the pandemic and of democratic governance than Latin America, which at the beginning of August had the world's highest death toll per population as a region. Before we dive into the event, a few logistical comments. First of all, this is the first of very many virtual events we will be bringing you this semester. For example, next week, we are going to have a discussion of the intersection of race and health in the United States that I think will be very interesting. We will also have events on a really wide range of topics, such as the impact that COVID-19 has on dementia care, the legalization of hallucinogenics for mental health issues, what sort of procedures should be available for IVF patients, as well as a roundtable discussing access to vaccines and treatment. Please join us. The best way to find out about events, which we are going to be adding continuously throughout the semester, is to sign up for our newsletter. I promise it's not going to fill your inboxes too often. It comes out twice a month on Fridays, and you can go to our website to sign up. If you are interested in asking questions during this event, and I strongly encourage you to, I hope that you ask questions, you can do so in one of two ways. You can use the Zoom Q&A feature, where the questions will be funneled to our moderator, or you can join the conversation on Twitter using the hashtag COVID South America. Again, that's hashtag COVID South America, and we will make sure that question gets uploaded into the mix. This is an international event. If you feel more comfortable asking your question in Spanish or Portuguese, we encourage you to do so. Lastly, before I hand this event over, I want to say that this event is in some ways a follow-up piece to a digital symposium that we did during the spring, looking at the impact of COVID-19 on democratic governance, rule of law, and human rights in about 30 different countries. I think it's a really great symposium. The pieces are fantastic. We strongly encourage you to go to our blog, The Bill of Health, and if you Google Petrie-Flom and Bill of Health, it will definitely show up, to see a snapshot of where the world was in the spring. In addition, we've updated the entries for the countries in this panel, in this case, Chile, Brazil, and Argentina, so you can understand what's happening there today. Again, we are delighted to have you, and with this, I would like to hand the event over to your moderator, Alicia Eli Yamin, who is the Senior Fellow in Global Health Rights at the Petrie-Flom Center. Ali, we are delighted to be in your capable hands.
I think I need to be unblocked so that they can see me, but I will talk anyway. Thank you very much, Carmel, for that introduction. And I just want to say a few other things. I'm also delighted that we could bring together this spectacular panel of leading experts in human rights and constitutional law and democratic theory from South America. As Carmel suggested, the global symposium that we did in the spring was a snapshot of where things were at the time. In fact, when I would do synthesis pieces, I'd often say things have evolved since the last time, because things have moved very quickly in this crisis, both in terms of knowledge of health, as well as in terms of legal and regulatory responses. I think you'll hear each of the presenters talk about significant changes that have happened in the last 5 to 6 months. And I also want to raise now that there are sort of two narratives about COVID-19, one of which is that it is a great disruptor, and we desperately need a vaccine to return to some normalcy. That's something that a number of political leaders have repeatedly affirmed. But there's another narrative that COVID-19 actually revealed structural flaws in our democracies. And I believe that you will hear in the presentations today that we don't want to return to pre-COVID. In Chile, there were massive protests on the streets for months and months, stemming from a transit fare hike, but then spreading throughout the country in an economy that is deeply shaped by neoliberal tenets. In Brazil in 2018, when an autocratic conservative president, Bolsonaro, came to power, 6 Brazilians owned as much as half, the bottom half of the population. And in Argentina, after years of some ill-conceived fiscal and monetary policy, which the IMF and Bretton Woods institutions were undoubtedly involved in heavily, there was a new election, but the president declared a crisis before COVID in December. So we'll hear, I think, about what it means to look at democracy and the rule of law in a forward-looking transformational way and not just return to a status quo ante. And with that, I want to introduce our first speaker, who is professor of law at the University Diego Portales in Chile. She's also the director of the Human Rights Center there, Professor Lidia Casas.
Thank you so much, Alicia and Harvard, for organizing this seminar. I think this is quite a timely and very important moment for South America. But I want to say that it's not just South America that is experiencing trying times, but I would say all the Americas. So I think it's a way of trying to put into context the social unrest that we are seeing not only in this continent, but also throughout the world. Well, I think you put it well. Chile is going through a very historical moment in the midst of a pandemic. In October 2019, we experienced the massive mobilization, social mobilization, sparked by a hike in fares in Santiago, but that's only really the tip of the iceberg, because beyond that, we could see for several years the amount of social mobilization of many of the social and economic rights. But the social mobilization actually permitted something that it was completely unthinkable a few years ago, and that is the change of a constitution, the possibility to have a deliberation on what kind of framework, constitution framework we should have. And why, the reason why I'm saying this is a historical moment, because the agreement that was reached in November in Congress is called the National Peace Agreement. In fact, it was in the midst of curfew, the police completely everywhere on the streets, and under the threats of possibly coming out with the military again on the streets. So the fear of losing democracy for many of us, it was close. It was close into a moment that it was really needed a social political pact to change the constitution. And that was a call for a national referendum for a change, for the possibility to change the constitution. And why I'm saying it's historical, because the Chilean constitution that does not have any mechanism to call on a plebiscite for such a change. It only allows for internal Congress-made constitutional reform, but not really to have citizens participating and deliberating politically. So that's why it was unthinkable and the most important issue. And it didn't necessarily mean that there were no criticisms how the agreement was reached. Many people, many individuals think that social organizations were left out of that agreement. And that's, I think, partly legitimate criticism, but under the circumstance, it was very important to come up with political stand to a political crisis and to a moment that it was possible, because many sectors on the right wing were willing to ask for the military to intervene. What is important about this particular agreement is that we have two issues that also were unthinkable: gender parity and also reserved seats for indigenous people. Gender parity well, in fact, we have this plebiscite coming only 6 weeks away from now. We have two mechanisms for under a vote. One of them is to vote for a full 100% citizen assembly, or a second option is a 50% elected assembly, the other 50% being composed by members of Congress. Gender and full gender parity will only work under a full 100% elected members of that Constitutional Assembly. And on the question of reserved seats for indigenous people, I think that's also a historical point, given the amount of conflict that we have lasted for hundreds of years, really, with indigenous people. But the question is that we do not have a clear mechanism yet how those people will be elected. In that context, one could place what is happening with the pandemic. If the social unrest and this massive mobilization of October is putting the pandemic revealed, just as you said, Alicia, all the flaws, all the structural inequalities that people were protesting on the street, but putting it very bare with the pandemic on the question of healthcare system, on the issue of working conditions, social security, and certainly housing. The most striking was one of the statements by the Minister of Health, that he did not have an idea the amount of poverty that in Chile existed. Chile has been sort of a model of development with a very strong, probably the strongest neo-capitalist model in the Americas. And so when you have a Minister of Health saying that he did not, in fact, had an idea how many people were living in poverty, in decrepit housing, overcrowded, which made it very difficult for people to control coronavirus in those conditions. So I think our challenge in terms of what it will be after the pandemic, which I don't know exactly when it will end, is that how we will change a constitutional model from what I call a consumer to a citizenship entitled model. Why do I say constitutional consumer model? Because the Constitution was set up in such a neo-capitalist model that people basically have to decide, for instance, on the private or versus public healthcare system. That's your option. It's not the right to health, but rather the right to decide which system of health do you want. In a similar vein, you have on the question of education. And one of the most important questions will be, I think, is going to be what's going to be the role of the right of property with respect to natural resources, especially the right of water. The pandemic made it once again evident that in some communities, some rural communities, people did not even have enough water to follow the recommendation by the health ministry to wash constantly your hands. And certainly the question is going to be what's going to happen with indigenous people, how they are going to be recognized. We do have a big chance to, I think, approve on for a change of constitutional framework, but it's still unclear which mechanisms will actually be voted in favor. There are all kinds of political statements trying to stop the plebiscite, but a vast majority of Chileans, in spite of the pandemic, will go out and vote on October the 26th.
Thank you very, very much, Lydia. Our second speaker is Octavio Ferraz, who is an associate professor at King's College London. He is also a senior fellow at the Fundación Getúlio Vargas in Brazil, and he has a book that is just coming out on health as a human right, the politics and judicialization of health in Brazil, from Cambridge University Press. So look for that. Octavio.
Thank you very much, Alicia, and thank you all from the Petrie-Flom Center for inviting me for this event. It's a great pleasure to be here again with Alicia and Roberto Garriera, and to know Lydia Becerra for the first time. So in my 8 minutes, which is really hard to try and summarize the situation of COVID-19 in Brazil, but I know that we are going to discuss later on as well. I will try to do 3 things. So first, I will provide a bit of context on the COVID situation in Brazil, which, as probably many of you know, is really bad. Secondly, I'll try to make a couple of comments on why I think the situation is so bad, or at least much worse than it could have been. And then I'll finish with what I see as a kind of a paradox in terms of the impact on democracy and the rule of law that the COVID-19 crisis has had in Brazil. And I'll try to relate that to Chile and Argentina. So most of these arguments, they are also in my blog pieces in the Petrie-Flom Bill of Rights blog, but not all of them. So as regards context, when I first wrote the piece for the Petrie-Flom blog on the 12th of March, Brazil had 11,000 deaths caused by COVID. And I had anticipated then that the situation would become much worse. And of course, I was not the only one to anticipate that. It was an open secret for anyone paying attention to the situation. So today we have 134,106 deaths, which is the second highest in the world, just after the US, but much higher than the US in per capita terms, because the population in Brazil is lower. It's 63 per 100,000, which is one of the highest in the world per capita as well. So why has it become so much worse? I already anticipated a couple of reasons in that blog piece in March, which I want to highlight again today. So the first one was what I called then institutional meltdown of the Brazilian political system. And the second one was something that hasn't started now with this government, nor the previous government, nor the few previous governments, but has been always a sad mark of Brazil, which is its high levels of social economic inequality, which Alicia has already highlighted in her introduction. So as institutional meltdown, then I described how there was a fight between the federal level and the states and municipalities about how to respond to COVID. So Bolsonaro was and still is a denialist of the health crisis. He still believes it's a small little flu and that the lockdown was a mistake. And everyone, I think, is very familiar with that, whereas states and municipalities were trying to do something about it. But there was also an infight inside the federal level, which I think was what distinguished Brazil from perhaps most other countries, in which the health secretary wanted to follow WHO and public health experts' suggestions to fight the pandemics. And that obviously didn't go down well with the president, so he was sacked. And then at that blog piece in March, a new health secretary had just started, and he lasted less than a month. And now we have an interim health secretary who is a member of the military and doesn't have much experience in health. So in the middle of the worst health crisis of the last 100 years, we have no health ministry organized with expert health people at the head. We have a lot of military people that the new military interim health secretary has appointed another 20. And this is how we are dealing with this crisis. As regards the high levels of social inequality, which are also very well known, I highlighted the so-called negative feedback loop between inequality and pandemics. So the poor have a triple disadvantage when it comes to pandemics. They have higher exposure to the risks, higher vulnerability, and more difficulties to access health care. And on the top of that, difficulties to follow public health measures like social distancing because of cramped accommodation and districts where they live, impossibility of home working, crowded public transport. So it was no surprise that with an institutional dysfunction of the government, especially the federal government, which is really important to coordinate an effort in such a big country like Brazil to respond to COVID and its high levels of inequality, that we would have such a high number of deaths and that they would affect the most poor and vulnerable. So just to cite a couple of numbers here that we can discuss later, as I see my time is running fast. There is a study now with 54,488 deaths of COVID-19 in Brazil, showing that the Black population is much more affected in proportional terms to the size of the population. There is also evidence that Brazil's profile of victims is much younger than in other places, which again indicates that the poor are suffering more for reasons we can discuss later. So to pick just one example, there are many others. Whereas in the United States, which is another bad example, as I'm sure Alicia would agree, 19% of the victims are below 65 years of age, which is already high in comparison to Europe. In Brazil, it's 26% are below 60. So there is a large number of people dying way before that age where COVID is regarded, at least in developed European countries, to be really deadly. To move on to the paradox, and there was much.
Very quickly.
Yes. So in most places, and I think Argentina is an example, Roberto mentions the health crisis as the perfect excuse for a government to strengthen its powers, like the presidential powers, and to impose draconian measures in the population. Interestingly, Bolsonaro didn't try that. He did the opposite. He's being accused of not doing anything to fight the pandemic. So I think we can discuss that later on if you want, but I think he lost, and I think Trump is a bit the same here, a great opportunity for leaders, authoritarian leaders, to strengthen their role. So he actually lost his strength during the pandemics for trying to dismiss the health crisis against the majority view of the population as something that wasn't important enough and that no measures should be taken. So he managed to antagonize the Congress, the Supreme Court, the population, and weaken himself in relation to these institutions as well. Of course, the situation in Brazil, to finish, it's still really difficult in terms of democratic backslide. We have gone down a lot, but the pandemic has paradoxically not made things even worse as it could have done. Thank you. Sorry for the overrunning a bit the time.
Okay, thank you very, very much, Octavio. And as you'll see, there's enormous variation among these countries. And as Lydia said, echoes with other countries, including between Brazil and the United States. Our third and last speaker is Roberto Garriera, who, for anybody who follows Latin American constitutionalism, is very, very well known. He's a senior researcher at CONICET in Argentina and a professor at the Universidad de Buenos Aires, as well as at the Universidad de Tella in Buenos Aires. Roberto?
Yes, thank you so much. Can you hear me? Well, first of all, I'm very, very pleased to be here with all these friends that I admire so much. And thanks so much, Alicia. I also admire you so much. Thanks for the center for organizing this. I'm not sure that the differences are so significant among our countries. I think that the one common rule has to do with discretion and I would say the autonomy of our political system that is out of control, meaning in comparison with the vis-a-vis the citizenry. But let me go back a little bit and do three things. First, show a little bit the context in Argentina, then say something about what I think are some of the causes, which are institutional in a way, and then say something about what is coming, which I think is quite worrisome. So first, I would say that the crisis has not been dealt irrationally by the government. Actually, the government was proud of showing surrounded by experts in the dealing with the crisis. But at the same time, I think that the main characteristic was this kind of discretion. So in a way, as you were saying, Alicia, at the beginning, like highlighting problems that we already have, and in a way also reinforcing the problems that we already have in terms of our institutional organization. It's striking how bad the administration of the crisis was, because we have a lockdown established the 20th of March. So we have already 6 months of lockdown, which has been at the beginning at least very strict. And we have we are in the top 10 of countries in terms of the number of cases that have been detected. And the number of deaths is also extremely high in comparison with other Latin American countries. So there is something very wrong in terms of how we have been administering the crisis. One evidence of this is the amount of tests. Argentina is one of the countries, probably the country with the lowest number of cases done according to the number of deaths that it has. So it's remarkable that it seems that the only important strategy in order to deal with the crisis was the lockdown. So that was basically the main thing, and done in the name of the advice given by experts. So there are many ways to understand these problems. My way of approaching to this is the institutional way. It's not the only way. It's not the only thing to say. But for me, this has a lot to do. And had to do, I would say, with at least two things. One is there is something more abstract regarding how we have been understanding democracy. So in this tension between experts and public debate, we have been going for the advice of the experts instead of public discussion, public recognition of the problem. And second is the concentration of powers. About this, the first thing to say is in Argentina, and this I would say has been more or less the rule in the Americas, as Lydia was saying, the crisis has been dealt in ways that they were in tension with our constitutions. This was clearly the case in Argentina. At the very beginning, lots of people say, well, I mean, we're in an emergency, so we cannot just trust the normal procedures. So go to Congress like in normal circumstances. This is the exception. From the very beginning, I said, this is not the way, not only because we need to be formalist, but we have to be formalist because we want the substance. Our constitutions require agreement, require democratic agreements if we want to, say, restrict rights. So it's not that, as Octavio was remembering, It's not that we have to use this as a perfect excuse to restrict rights or increase your power or increase your discretion in the name of the emergency. And this has been a debate everywhere, but has been clearly significant in my country, where the emergency from the very first minute gave the excuse to the president to decide basically as he wants. And this also is objective in the sense that he took for himself the authority to discretionally lead with the budget in the way he wanted, basically. So from the very first minute. So this has been very significant. Of course, one step back, this goes to a problem that is common because of a tradition, which includes, for example, in my country, the management of the state of siege, or the capacity for the president to intervene in the provinces with military authority. So we are in a tradition of countries living with a concentration of power. One thing about the democracy, stay in your homes. Well, that's a typical nice advice coming from the medical community, but it's a medical community from the center of the world. In Latin America, where millions of people have no access to clean water, or they live all together in one room, like 10 people per room, then the idea could have been the opposite. Just leave your room, stay outside, go for fresh air. So the idea that, no, in the case of emergency, now is the time to go for experts or to concentrate authority or to decide quickly. Well, this is the problem with democracy. In democracy, we tend to say the opposite, but not just because we like to talk to each other, because we need it, because if not, we take biased decisions, class decisions, bias in terms of class, in terms of profession, etc. So we didn't listen to the most affected people who could have told us, I mean, no, we need to do the opposite. We don't have water to wash our hands. So there is a problem which is more abstract in terms of how we understand democracy. Well, the situation now in Argentina is one where the president took the possibility, so use the excuse to gain discretion. And at this moment, this has been having extremely grave, serious consequences. I mentioned 3 little examples, which are for me devastating, I would say for us, and I really think that very serious things are coming, worrisome things. So one example is, there was an expropriation, which was out of the blue. Nobody understood why it was coming. The president just decided from one day to the other, and was basically, I would say, out of caprice, I would say. Second, much more serious, is the search for impunity. This week, we have been having discussions of a judicial reform that nobody understands in terms of the opportunity, the cost that is implied. It's incredible to be thinking at this very moment of the crisis, enough beds to incredible, huge reform in the judicial system, basically persecuting impunity, persecuting the impunity of those who are now in government, who were in government before. So we are persecuting an incredible judicial reform in terms of opportunity, in terms of the procedures have been chosen, in terms of the means, in terms of the goals, in terms of what is not doing. So it's really surprising. For me, it's difficult to explain. As a sociologist and as a lawyer, I don't understand, but out of craziness, in terms of just sheer egoism, in terms of self-interest. So it's very, very difficult to explain. But institutionally, I explain it out of this gaining discretion, increasing discretion. The last point, and I end, is a fight between the city of Buenos Aires and the rest of the country in terms of the distribution of the money. Given the discretion the president has, last week, he took away 1 point of the budget of the city, basically to punish the city, to say, the city of Buenos Aires, which is controlled by the opposition party. So these are just 3 examples of the consequences of a very discretionary system. So the pandemic has given the government the excuse to reinforce what it wanted to do from the very first time, as you said. So I stop here, but we can talk about this later.
Okay, wonderful. Thank you, Roberto. There are already some questions in the Q&A. I want to ask each of you a brief question with a brief reply, although I don't think they're easy questions, and then go to some of the questions in the Q&A so that people who are watching can participate. And I'll do it in the reverse order. So my first question is to you, Roberto. You mentioned frequently experts, and this is not how we like to think about things in democracy, because experts have a kind of unitary view that is not contextualized. But in a health crisis, there are fields of knowledge that respond to special health expertise, and presumably knowledge of the pathophysiology, knowledge of the epidemiology, which has evolved, are very important to making those decisions, just as they will be in other crises that are coming down the pike, like climate change. So how do you construct a deliberation that is meaningful with kinds of expertise that are specialized, if you will?
Alicia, take the case of reproductive rights or the abortion debate. Of course, we need to listen to the opinion of doctors or experts in international law to tell us, I mean, what happens when the international, the inter-American community and the Covenant of Human Rights, etc. We need to listen to those experts. But in the debates we have, for example, in Argentina 2 years ago, for many of us, it was crucial to listen to a woman who had been raped, to a 14 years old who tell us about the solitude of her decision. So in health questions, in very crucial questions about rights, I would say, of course, it's important to listen to the experts, but together with all the other voices who tell us what they suffer, what they need, what they want. And this, I would say, is a rule all along the problems, no? So all the important public problems should be sought in the same way, I would say. So in light of the public debate.
Okay, and Octavio, this is a question for you. In law, you know, we are, and you brought this up very much in your talk, we're very used to what are the powers that a government can have. Roberto talked extensively about this, and what are the limitations on the exercise of those powers, discretionary or not. But we're not as used to thinking about what happens if the government doesn't do what it is supposed to do, what it should do, if it demonstrates massive indifference to human suffering by not taking action. So I was wondering if you have thoughts about that in the context of Brazil in terms of holding Bolsonaro or other people in the government responsible in some way to move past this time. Octavio? He seems frozen. Octavio? Okay, well, I will go on to my question to Lydia and see if we get Octavio back. The question for Lydia is that, you know, and it builds on something that was in the Q&A too. Chile is facing this constitutional referendum as a country that has institutionalized neoliberal policies for many, many years. And one of the things about the social constitutions in Latin America that has been so prevalent is judicialization. So there's been a strong critique of judicialization of social rights, that it in a sense sort of neoliberalizes those social demands. And I imagine that after the pandemic, there will be even greater demands for health care, for example. So I wondered what your thoughts about that and the relationship between the experience Chile has had in the pandemic and how that might play out in a new constitution. On mute.
I just want to make a small point with regard to what Roberto said. I think this question of social deliberation and COVID is very important. I think one, perhaps coming from the social mobilization, is in fact that in Chile, they striked what is called a social COVID working group. That meant putting together the scientific community, social organizations to talk about how to deal with the pandemic and having a dialogue, not usually very fruitful, but pushing government to have conversations and dialogues about how to go about it. And I really understand the idea of having conversation with evidence-based, but at the same time trying to engage with the community. With respect to what will come out of this constitutional reform, I think it's going to be quite interesting, is a question on social security. We had just as a result of the pandemic, having a very important question is that in Congress, you managed for the first time to break away with presidential powers, dealing with one of the most demanded issues is social security and pension plans. So judicialization, I don't see it as a road in Chile. I think we need structural changes. Judicialization will not respond to what people are needed. In fact, we did have just few cases of people willing to take away their pension plan monies out of the funds and to dispose just as a question of over the right of property. And that, although they did win at the courts of appeal, it was struck down at the Constitutional Court. So I think this is an opportunity, in fact, to think about social rights in terms of the model, the design that could inspire in the Constitution, but that has to be translated in public policy. So Chile is coming to a very important moment where the kind of model that we will go will in fact be able to at least diminish the idea of that neoliberalism. I'm not sure that we will go and strike down neoliberalism, and because I think it's very difficult in a whole capitalist economic structure. That is, I think a constitutional change is beyond that possibility, really. And certainly the way that the mechanism is set out, we need 2/3 of votes for that constitutional assembly to make changes, like structural changes. And so responding to the question on the question and answer, it will really be trying on the question of how many seats people, how many people will be elected to come with a design to change the model. But at the same time, being very aware, cognizant that the right wing is organizing in very sort of discipline, not the opposition, on what that model might be for the future. And I think that's the challenge for democracy for the next few years in Chile.
Thanks, Lydia. Octavio, are you back? Unmute.
Hi, can you hear me now?
Yes. So did you hear my question?
I heard part of it, that
okay, so
we tend to...
I'll meld my question with a question that came from the Q&A, which was
Okay.
how you know, we are used to imposing legal rules and guardrails around the exercise of unfettered discretion in law. And that is something that we've heard a lot about today from Roberto. But what do we do in the event that the government should be doing something? How do we incentivize politically or hold them accountable if they don't? And a question from the Q&A that is related is about this paradox of conservative populists in federalist countries often withhold things instead of acting to centralize further their power and impose authoritarian will. And could that be part of the paradox?
Yeah, I think it's part of the paradox. If it is a paradox, I just put that for debate, and I was hoping to hear Roberto and Lydia about this. But I think it's surprising that you usually want to limit the power of strong leaders, authoritarian leaders, and they take advantage, like in Hungary now, in Poland, to usurp more powers. And it's, according to Roberto, is also the case in Argentina. And although Bolsonaro did try, to be honest, at the beginning, to do a bit of that when he said, but to stop doing anything about the pandemic, to stop lockdown, he was quickly rebuked by the Supreme Court and then by Congress. And he could have tried to declare a state of emergency. But these are very hard in Brazil, and to do it constitutionally, you need the approval of the majority of Congress. So he knew he didn't have the support of the population or the Congress of the Supreme Court to do that. So in the end, what he did was, okay, I wash my hands. It's in the hands of the states and municipalities now, and he's now blaming the states and municipalities for the disaster which has occurred in very contradictory terms, because he thought that nothing should be done. So how can he blame them now? But I still think it is an interesting, I call it paradox, perhaps exaggerating it, but why has he not tried to use this perfect excuse to grab more powers? Probably because, like Trump, he believed strongly on chloroquine and on not doing anything about the pandemic, not to harm the economy. But I think it's something, it's a puzzle that we will be thinking about for some time now, especially if in the next elections this comes back to haunt him, like his performance during the pandemic.
Yes, we can only hope that those miscalculations will also affect elections here as well. There's a question in the Q&A about Uruguay and why the panelists think that the response in Uruguay has been quite different, especially from Chile and Argentina. Lydia, Roberto?
Oh, I probably has to do with political culture, but I wanted to say something which is in part about culture, in part about institutions again, and relates to what Octavio has been referring as the democratic erosion. That I think is a common problem, but I think there is in Latin America, or at least in many of our countries, there is something that is still worse, which is at least very clear in Argentina, that the bridges between representatives and the citizenry have been burned. There is almost no connection. So, and there is a feeling of that in terms of culture. There is a sense of disempowerment. So you see that you don't decide and you don't control. And this, in the context of the abuses and discretion I was talking about, is generating again a climate of very similar to what happened in the crisis 20 years ago in 2001, which the motto of get rid of them all, they should all leave power. So it's a very anti-political in the sense of anti-political parties movement, doesn't mean that it's anti-democratic or is anti-politics in the sense of empowerment, but it's against the political class. So that feeling suggests something very serious for what is coming in Argentina. And this is something that we radicalize here, but we find in many other countries in the world. We saw it in Spain, we saw it in Greece, we saw it in Brazil at one point, we saw it in Chile at one point, in Bolivia. So there is an anger in terms of we don't control, we don't decide, they are doing whatever they want. This, at this moment in Argentina, is quite radical, and that's very worrisome. That's what I wanted to say at the end of my presentation, but I think it's more general. It's clear in Argentina, but I think it's more general. And say something about the state of our institutions, the impoverished state of our institutions.
And I think that is a sentiment that goes beyond South America. It's certainly a sentiment against political classes in much of the world, and has to do with the hollowing out of political possibilities.
Yeah, but it really varies according to how you receive it institutionally, in terms of inequality, in terms of the strength of your institution. So we are receiving that crisis in a very bad situation with very high levels of inequality and very weak institutions, I would say, at least in my country.
So I want to touch on, there's one question to you, Lydia, and I'm not sure if you feel from Marco Antonio Núñez about what are the reforms that you see as necessary to improve access to health conditions and healthcare in Chile. And then there's a broader question to the rest of the panel that I'll leave till the very end.
Well, on the question of Marco Antonio, I think one bit of a context. Chile has a dual health system. One is a private insurance health system, where no more than 20% of the population uses, while 80% of the people go and use the public healthcare system. What is quite clear in the pandemic is the one that that supported the crisis was the public healthcare system. And so the core of the obligation and the kind of attending the needs of the population is the public healthcare system. So what we need is a revamp of the whole healthcare system as a whole. It doesn't necessarily mean, for people who really think that we are going to outdo with the private enterprise, but you need to really strengthen the public healthcare system. Although we do have really, really high numbers of people that died as a result of COVID. It's close to 16,000. And we did quite a bit of testing as opposed to Argentina, and Argentina is always competing for some reason about the testing, the numbers of death, which is really irrelevant. The point there is that we should think in terms of a constitutional clause that talk about the right to health. But that right to health has to be translated, as I stated before, in public policy. And that public policy is trying to put the public health system at the center of the conversation. And usually people think about the public healthcare system in terms of hospital-based. And I think, again, COVID has once again demonstrated the need to strengthen primary healthcare system. The idea of tracing is essential to be at the community base, not at tertiary level. Tertiary level, when you go and invest in beds in hospitals, you are losing sight is that you do have to do preventive healthcare. You have to invest in prevention rather than always putting your money at the very end. I don't think I may respond to Marco Antonio's idea, but healthcare is not a question of choosing private and public. It's rather putting the right to health in terms of the social covenants on the right to health, but also in trying to reform in trying to put the emphasis on the public healthcare sector.
So I misspoke. There are a few more questions that we'll try to get through very quickly. One, Roberto actually has a question for Octavio.
Yes. No, Octavio, just trying to see, to understand. I mean, if there is something really different with the Bolsonaro situation. My intuition, not knowing very much about the system in Brazil, but I see that the political system is so incredibly fragmented, and in Congress the forces are so dispersed that he's not able actually, even if he wanted, to control all and move that dinosaur, that elephant. In Argentina, the government controls part of the Congress, and they do whatever they can, everything, crazy things with that control. But because they have that, so perhaps Bolsonaro doesn't control that, and he acts like a free-floating person in the context of that institutional division.
Yeah, no, I agree. So that there is this barrier. But what I was trying to say is that given this fragmented nature, is the perfect situation for a president to try and put the crowds against Congress, right? To say, we need this. They are not letting me act like I want to act. But I don't think it would work either, because most of Congress and the country wanted the federal government to act. So he would just be running along the lines that people wanted him to act. But he could have used at least some of these extra powers that would have been given to then try to strengthen his power. But just a couple of examples that I forgot to mention, Alicia, because you asked, what can we do in those situations paradoxically where the government is not acting? So what happened in Brazil was that the other actors took the initiative. The other political actors took the initiative. Where there is a power vacuum, it is occupied. So there was protective laws in Congress for the vulnerable communities, like the indigenous people, the Black communities, for the use of masks. And what did Bolsonaro do? Try to veto them. There were 25 vetoes on the law to use masks in Brazil by him, and 27 on the one trying to protect the vulnerable communities. So he vetoed things like giving them access to water, which is also a big problem in Brazil as it is in Argentina, or access to hygiene products, access to food, even a basic basket of food. He vetoed, and what happened? The Congress overturned the veto. So there was obviously a cost. It takes like a month or so for Congress to be able to overturn a presidential veto, which in a pandemic situation is a lot of time. But it's incredible, like he's being seen as the person who is blocking the effort. So I think it's really bad miscalculations, and which is lucky in a way for us who want to end this government like as quickly as possible. But it's also disastrous in terms of what's happening in the pandemic.
So that's a great answer. We really do have to start wrapping up. That there is a question from Brazil, because the municipalities have played such an important role, as they have here, by the way, because of complete abdication by the federal government. So municipalities have different rules from, you know, one town to the next in the United States, as I believe they do in Brazil too. And I'm wondering, the question is whether the same has happened in Argentina or Chile, if we know that.
What I actually wanted to say is basically local powers, local governments in Chile were the ones that pushed for closing the schools, and in fact taking an active role and asking for the confinement. And so in that way, local governments did erode partially the power that the president had. And it was interesting that local communities and local governments are closer to the people and trying to be attuned to the needs. So I think that has to be taken care of any future political analysis.
So I think our time is over, and there are still a couple more questions, but I'm going to try to synthesize. One relates to the vaccine and distribution, and I'm not sure if that is the right question for this crowd, although there will certainly be ethical issues in how the vaccine gets distributed to vulnerable and other populations throughout the region. But the larger question is that these disruptions have happened from time to time, and what in each of your minds is sort of the most important thing to have Chile or Argentina or Brazil move beyond this pandemic on a path to a more, because we won't have it, but on a path to taking steps toward creating a more robust, egalitarian, deliberative democracy. Lydia, let's start. Let's go in the order of presentations. Lydia?
Well, I think that one of the issues will be deliberation and how really stronger deliberation takes place, not only with respect to political formal questions of law and how those are adopted in Congress, but also how public policies are modeled with the consultation and participation of citizenry. That's how I envision that we have to move forward.
Octavio?
Well, those are huge questions. So we start with the vaccine one. I would like to actually comment on Lydia's point about putting the right to health in the new constitution. This is what is saving Brazil. So Brazil has one of the best immunization systems in the world, which hasn't been dismantled yet by this government. And when a new vaccine arrives, if we still have this system in place, and I think we will because it's robust and has strong roots, we will use it again to show how public health system based on the right to health can actually help a lot the population and diminish inequalities in the process as well. As to the political situation in Brazil, it's really hard to be optimistic at the moment. I think things will have to become a bit worse before they get better. We are still 2 years away from the next elections. I think if the elections were now, like in the US, we would kick Bolsonaro out. But who knows what is going to happen in 2 years' time. And the damage to democracy has been quite significant. Therefore, there will be a lot of time to recover, a lot of space to recover. Brazil has dropped significantly in all indices of democracy in the world. And to get back to where we were, say, even 10 years ago, will be tough. I'm sorry to end on a negative note, but it's hard not to end any other way at the moment in Brazil.
Thank you for your candor. Roberto?
No, I have a similar message. No, my hope, of course, go in the direction of, it's obvious, of democracy, deliberation. But history goes in the other direction. Equality, crisis and inequality form a bad team. No? When you have both things together, that's a bad news. Because the usual way you go out from the crisis in a context of inequality is with more inequality. So that's what I see in Argentina, and that's why I'm worried about that.
Well, on that note, I want to be more positive. Certainly it's going to be an uphill battle, but I also think that this pandemic has been so sweeping and has affected so many lives, not just in South America, but around the world, that the things that the natural, brutal, savage inequalities that we had taken for granted and the dysfunction of our democracies is now impossible to ignore. So I can try to be hopeful, and we can all try to work toward an improved state of democracy, as well as recognizing that public health and population health is part of that well-being. So I want to thank all of our speakers, Roberto Garriera from Argentina, Lidia Casas from Chile, and Octavio Ferraz from Brazil. And I also want to thank everybody who tuned in today. There were a lot of great questions on the Q&A that we didn't get to, and I apologize for that. And I also want to thank the Petrie-Flom Center for hosting this great event. We will make the video available eventually for people who want to watch it. So thank you very much.
Gracias.
Thank you.
Thank you.
Muchas gracias.
Chao.
Thanks
Obrigado.
to you
Chao,
all.
Lidia. Chao, Alicia.
Ciao.